Welcome to another episode from the Veterinary Medicine Digest, the canine dystrophinopathies, a veterinary perspective. Today, we delve into a profound and challenging area of veterinary and human medicine, muscular dystrophy in dogs. This severe, muscle-wasting disorder, particularly the form known as Duchenne Muscular Dystrophy, represents a constant focus for researchers seeking effective therapeutic interventions. We are fortunate that canine models offer an invaluable and highly translational bridge for understanding this disease and testing novel treatments. Muscular dystrophy is a heterogeneous collection of inherited muscle disorders, defined by the progressive degeneration of striated muscle. The most prevalent form, Duchenne muscular dystrophy, is an inherited disorder caused by mutations in the gene that produces the essential protein known as dystrophin. Dystrophin is a large scaffolding protein crucial for maintaining the structural integrity of muscle fibers. It serves as a core component of a vital structure called the dystrophin glycoprotein complex, anchoring the actin cytoskeleton of the muscle fiber to the extracellular matrix. Without sufficient dystrophin, muscle fibers become fragile, leading to the disruption of the cell membrane, mechanical coupling is impaired, and they are highly susceptible to damage induced during muscle contraction. This eventually results in widespread muscle degeneration, necrosis, and subsequent replacement by fibrotic or fatty tissue, culminating in muscle weakness, atrophy, and contractures. The affected animals and humans typically face premature death, often due to catastrophic respiratory failure or severe heart muscle disease, known as cardiomyopathy. In veterinary medicine, dystrophin deficiency is often classified as Canine X-linked Muscular Dystrophy and has been identified in numerous breeds, though it is perhaps best known and characterized in the Golden Retriever model. The prognosis for affected dogs is considered grave, with many succumbing to the fatal complications before reaching 2 years of age. The pillars of research: canine models. Animal models are indispensable tools for investigating the complex pathogenesis of Duchenne muscular dystrophy and accelerating the development of therapies. While mouse models, particularly the MDX mouse, are frequently used, they often exhibit only a mild or attenuated disease phenotype. In stark contrast, dog models manifest many of the key phenotypical characteristics observed in human patients, and their larger size and weight make them superior candidates for translational studies concerning treatment delivery, such as gene therapy. The Golden Retriever Muscular Dystrophy model, often referred to as GRMD, is the most established and widely recognized canine model. These dogs harbor a specific mutation, a point mutation in intron 6, which causes erroneous splicing of exons 6 through 8, ultimately disrupting the reading frame of the messenger ribonucleic acid transcript. The Golden Retriever Muscular Dystrophy model is recognized as reproducing the human disease course more faithfully than other available animal models. Affected dogs in this model exhibit dystrophic muscle lesions, early limitations in movement, progressive fibrosis, and premature death resulting from respiratory or cardiac failure. Another crucial model is the Canine X-linked Muscular Dystrophy in Japan, or CXMDj model, established in beagle dogs by breeding with affected Golden Retriever Muscular Dystrophy dogs. This beagle model displays progressive symptoms of muscle weakness, aligning with the disease progression observed in human Duchenne muscular dystrophy. More recently, the Delta E50 Muscular Dystrophy model, or DE50MD, has gained prominence, particularly because its mutation, a point mutation in intron 50 causing the exclusion of exon 50, falls within a major mutational hotspot of the dystrophin gene in humans, specifically encompassing exons 45 through 53. This makes the Delta E50 muscular dystrophy dog exceptionally relevant for developing gene therapies aimed at this common genetic region. The Delta E50 muscular dystrophy dog model shows a disease progression similar to that seen in younger human patients, covering the period before the typical loss of ambulation. Clinical signs of Duchenne muscular dystrophy in dogs typically manifest as general weakness, gait abnormalities, problems with mastication and swallowing, dysphagia, and, in some cases, macroglossia, or an enlarged tongue. A striking case illustrating the complexity of this disease involved an 8-month-old crossbreed dog diagnosed with a Becker-like muscular dystrophy, a milder form of Duchenne muscular dystrophy associated with reduced but not absent dystrophin protein. This dog presented with pronounced macroglossia, reduced mandibular extension, excessive drooling, tibialism, and difficulties with swallowing and regurgitation. In this case, immunohistochemical analysis of muscle biopsies confirmed a reduction in the dystrophin protein, notably undetectable staining for the carboxy terminus of dystrophin in most fibers, supporting the diagnosis of a Becker-like muscular dystrophy. The diagnostic imperative: monitoring disease progression. A cornerstone of clinical diagnosis and research monitoring is the consistent measurement of specific biomarkers. The presence of markedly elevated and persistent creatine kinase activity in the serum is a critical, common finding in affected dogs, which should immediately raise suspicion of muscular dystrophy, regardless of the presence of overt clinical signs. Creatine kinase and other enzymes, such as aspartate aminotransferase and alanine aminotransferase, leak from damaged muscle fibers, serving as early diagnostic indicators. Beyond these chemical markers, comprehensive evaluation requires sophisticated tools, especially given the involvement of the heart and skeletal muscles throughout the body. Cardiopulmonary monitoring. Cardiovascular disease is now recognized as the leading cause of death in Duchenne muscular dystrophy patients who have received respiratory support, underscoring the critical need for accurate cardiac assessment in canine models. Researchers employ several non-invasive cardiophysiological evaluations in models like the Canine X-linked Muscular Dystrophy in Japan dog, often conducted under inhalation anesthesia. These techniques include echocardiography, the 12-lead electrocardiogram, and the 24-hour Holter electrocardiogram. For more detailed structural and functional insights, magnetic resonance imaging is used, sometimes incorporating specialized cardiac magnetic resonance imaging software and compatible electrodes. Echocardiography allows for the measurement of left ventricular diameters and volumes, providing values for parameters such as the left ventricular shortening fraction and the left ventricular ejection fraction. Studies show that dystrophin-deficient dogs exhibit a significant reduction in both left ventricular ejection fraction and left ventricular shortening fraction compared to wild-type controls, indicative of systolic dysfunction. Longitudinal monitoring has revealed that the left ventricular ejection fraction decreases progressively, showing a decline of approximately 1.9 percentage points per year in male Duchenne muscular dystrophy dogs. Magnetic resonance imaging is particularly valuable for detecting myocardial fibrosis, a hallmark of progressive heart disease. An optional evaluation involving the injection of gadolinium contrast media allows for late gadolinium enhancement imaging, where fibrotic degenerations appear as white lesions, consistent with findings from pathological staining studies. In addition to structural changes, the autonomic nervous system is impacted, measurable via the 24-hour Holter electrocardiogram. This monitoring tool provides data on heart rate counts and variability. Dystrophin-deficient dogs, including the female carrier dogs in the Canine X-linked Muscular Dystrophy in Japan model, exhibit higher mean and minimum heart rates than wild-type dogs. Furthermore, heart rate variability analysis reveals a decrease in variables such as standard deviation of the normal RR period and high-frequency spectra, which are metrics related to parasympathetic activity. For the respiratory system, a unique radiographic feature often seen in dogs with Duchenne muscular dystrophy or Becker-like muscular dystrophy is diaphragmatic thickening in the presence of an axial gastroesophageal hiatal hernia. This hernia is presumed to be connected to the primary myopathy affecting the diaphragm muscle. Respiratory function itself can be quantitatively assessed using techniques like respiratory inductance plethysmography, which measures stretching signals from thoracic and abdominal belts to calculate flows. Assessing movement, gait and locomotor activity. Traditional clinical outcome measures often rely on evaluator consistency and patient compliance, posing challenges in animal studies. Therefore, digital outcome measures utilizing digital devices and instruments have become highly favored for quantitatively capturing clinically significant changes in dystrophic dogs. Accelerometry is a key technique, involving portable sensors typically affixed to the dorsal cervical, neck, thoracic, chest, and lumbar, lower back, regions of the dog using sticky bandages. These sensors detect three-axial acceleration and angular velocity during movement. By monitoring gait and standardized tests, researchers can analyze multiple parameters, such as acceleration magnitude and the relative components of acceleration along the three axes, caudal cranial, medial lateral, and ventral dorsal. This analysis provides quantitative data on parameters like speed, stride length, and stride regularity, demonstrating reductions in these metrics in dystrophic animals compared to their wild-type counterparts. In a study evaluating nicotinamide supplementation, gait quality was assessed using three-dimensional accelerometry, involving dogs wearing a device near the center of gravity. Traces of acceleration were recorded during walking or running, and a force index was calculated by normalizing the total power of acceleration by the gait speed, expressed in newtons per kilogram. This allowed researchers to observe a trend toward stabilization of clinical score and gait force in the treated dogs compared to untreated Golden Retriever Muscular Dystrophy dogs, though the overall improvement was modest. Infrared monitoring provides a method for assessing spontaneous locomotor activity over longer periods, such as overnight, in a test cage. This system uses an infrared sensor mounted above the cage to detect the dog's movements as changes in heat, providing a count of spontaneous movements, both vertical and horizontal. Dystrophic dog models, such as the Canine X-linked Muscular Dystrophy in Japan model, utilize this technique to confirm reduced spontaneous locomotor activity compared to healthy dogs. Deep dive into muscle mechanics. The most sophisticated method for assessing muscle health and the efficacy of therapeutic agents involves directly measuring skeletal muscle function under anesthesia. This method is crucial because improvements in muscle function are the ultimate measure of successful treatment. In longitudinal studies, dogs are placed under general anesthesia in dorsal recumbency, and muscle torque is evaluated for the tibiotarsal joint flexor and extensor muscle groups. This involves positioning the leg joints at 90-degree angles and taping the tarsus to a force-transducing foot pedal. Percutaneous needle electrodes are used to supramaximally stimulate the tibial and fibular nerves, inducing twitch or tetanic contractions. Isometric contraction analysis measurements during isometric contraction, where muscle length remains constant, show that dystrophin-deficient dogs typically exhibit lower maximum absolute force and relative force in the tibiotarsal joint flexors compared to wild-type dogs. This reduced force generation is generally observed from 6 months of age onwards. Unlike the MDX mouse model, where muscle force might be higher due to compensatory hypertrophy, dog models like the Delta E50 muscular dystrophy dog tend to exhibit reduced muscle volumes, atrophy, which contributes to their overall lower absolute force. Normalizing the absolute force to the dog's body weight provides a relative force measurement in newtons per kilogram, helping to account for differences in body mass. Contraction and relaxation dynamics analysis of how quickly muscles contract and relax provides mechanistic insight. In many cases, dystrophin-deficient dogs demonstrated prolonged relaxation times after maximal contraction compared to wild-type controls, a feature particularly noticeable in the terminal stages of relaxation. While a modest slow-to-fast fiber type shift was unexpectedly observed in the cranial tibial muscle of older Delta E50 muscular dystrophy dogs, at 18 months of age, which should theoretically hasten relaxation, the overall prolonged relaxation is more likely attributable to dystrophic changes like increased endomysial fibrosis and incomplete clearance of calcium ions during the relaxation phase. The time taken for the tibiotarsal joint flexor muscles to relax to 95% completion was significantly longer in dystrophin-deficient dogs for both twitch and tetanus stimulation. Eccentric contraction decrement, the gold standard biomarker among all measured physiological parameters, the eccentric contraction decrement protocol stands out as the most predictive and objective biomarker for assessing functional efficacy in preclinical trials. Eccentric contractions occur when a muscle lengthens while actively contracting, generating a braking force. Dystrophin-deficient muscle is uniquely susceptible to injury under this stress because the absence of dystrophin compromises the sarcolemma's ability to withstand mechanical stresses. In the eccentric contraction decrement protocol, the tibiotarsal joint flexor muscles undergo repetitive eccentric stretches while under tetanic contraction. The force loss or torque decrement that results from these contractions is measured. In the Delta E50 muscular dystrophy model, the torque loss was significantly greater for dystrophin-deficient dogs compared to wild-type dogs from 6 months of age through 18 months. After 30 eccentric contractions, dystrophin-deficient dogs showed severe torque loss, demonstrating the high susceptibility of their muscle fibers to mechanical damage. The significance of the eccentric contraction decrement test lies in its high statistical power and sensitivity. Calculated sample sizes indicated that this measure could detect an improvement as small as 25% in resistance to eccentric contractions using a minimum group size of only 2 animals per genotype, highlighting its efficiency and value as a primary outcome measure for future preclinical studies. Therapeutic strategies, from metabolism to gene correction. Canine models are indispensable not just for phenotyping, but also for testing promising therapeutic strategies, ranging from nutritional supplements targeting cellular metabolism to cutting-edge gene editing technologies. Nicotinamide adenine dinucleotide repletion. Recent studies have identified nicotinamide adenine dinucleotide, or NAD, as a crucial metabolic cofactor essential for energy production, particularly in striated muscles. Maintaining the balance between nicotinamide adenine dinucleotide consumption and biosynthesis is vital for cellular function and tissue homeostasis. Research revealed that in Golden Retriever Muscular Dystrophy dogs, nicotinamide adenine dinucleotide content was significantly decreased in both heart and skeletal muscles, and this reduction was present even in young animals at early stages of the disease. This nicotinamide adenine dinucleotide depletion is linked to alterations in the salvage biosynthetic pathway and increased consumption by a class of enzymes known as poly-ADP ribose polymerases, or PARPs, which activate in response to cellular stress, accelerating the depletion of nicotinamide adenine dinucleotide pools. Researchers hypothesized that boosting nicotinamide adenine dinucleotide levels could be therapeutic. They tested supplementation with nicotinamide, a natural precursor to nicotinamide adenine dinucleotide. Short-term nicotinamide supplementation, 500 mg, twice daily for 1 month, in Golden Retriever Muscular Dystrophy dogs successfully increased nicotinamide adenine dinucleotide levels in skeletal muscles. While major improvements in muscle force were not observed, this treatment did yield a mild beneficial effect, most notably a significant improvement in the maximal inspiratory and expiratory flows ratio, suggesting a modest stabilization of respiratory function compared to untreated dogs. This approach highlights nicotinamide, an easily implementable nutraceutical, as a potential complementary treatment for managing disease progression. Gene editing and delivery. The advent of gene editing technologies, such as CRISPR-Cas9, holds immense promise for Duchenne muscular dystrophy treatment, aiming to restore dystrophin expression by correcting mutations. The Delta E50 muscular dystrophy dog model was used to test a single-cut genomic editing strategy delivered via recombinant Adeno-Associated Virus serotype 9. Adeno-Associated Virus serotype 9 is favored because it displays preferential tropism for skeletal and cardiac muscle tissue. Initial tests involved intramuscular injection, resulting in widespread dystrophin expression in the injected cranial tibialis muscle fibers, reaching up to 60% of wild-type levels in one animal after 6 weeks. Histological analysis showed that the treated muscles appeared normalized, with fewer necrotic fibers, reduced fibrosis, and fewer regenerating fibers compared to untreated controls. The therapy was then tested through systemic, intravenous, delivery in young delta E50 muscular dystrophy dogs. This approach proved effective in delivering the gene editing components broadly across the body, including vital organs like the diaphragm, heart, and tongue. At the highest dose tested, systemic treatment resulted in remarkably high levels of dystrophin restoration, up to 92% of normal levels in the cardiac muscle, and high percentages across various skeletal muscles, such as 70% in the cranial tibialis and 64% in the biceps. Furthermore, muscle sections from the treated dogs showed recovery of the entire dystrophin-associated glycoprotein complex. These high restoration levels, achieved within an 8-week period, offer compelling evidence supporting the clinical potential of this gene editing approach for treating Duchenne muscular dystrophy. The role of modifier proteins in lymphatic dysfunction. In Duchenne muscular dystrophy, the severity of the disease can vary widely, a phenomenon influenced by genetic modifier proteins acting outside the dystrophin gene itself. One such protein is desmin, a muscle-specific intermediate filament protein that strengthens the structural stability of the muscle sarcomere, linking myofibrils to the sarcolemma. Studies in dystrophin-deficient mice revealed that the insoluble, polymerized form of desmin was elevated in the heart muscle. This increase appeared to be protective, as total deletion of desmin in these mice led to a severely exacerbated dystrophic phenotype, characterized by greater cardiac dysfunction, increased fibrosis, and exacerbated morphological damage to cardiomyocytes. Supporting the protective role hypothesis, the severe Golden Retriever Muscular Dystrophy dog model did not show this protective increase in insoluble desmin levels in the heart muscle, unlike the milder mouse models. Researchers noted that the accumulation of filamentous desmin seems to be achieved through enhanced stabilization, evidenced by increased desmin phosphorylation, decreased degradation by the protease calpain-1, and increased expression of chaperone proteins like alpha-B crystalline and heat shock protein 27. Lymphatic system involvement beyond muscle fibers in the heart. Research highlights that the lymphatic system is significantly dysregulated in Duchenne muscular dystrophy animal models. The lymphatic system is crucial for fluid homeostasis and managing inflammatory processes. Studies involving both dystrophin-deficient mice and Golden Retriever Muscular Dystrophy dogs revealed a significant decrease in lymph transport function. In the Golden Retriever Muscular Dystrophy dog model, this impairment was confirmed using magnetic resonance lymphangiography, showing a reduction in contrast density measurements over time compared to carrier dogs. This lymphatic dysfunction is strongly linked to the disease pathogenesis. Dystrophic muscles exhibit pathological lymphangiogenesis, characterized by an upregulation of lymphatic marker genes like podoplanin, along with increased expression of various pro-inflammatory markers. Importantly, this lymphatic dysfunction appears to precede or correlate with the persistent inflammation and muscle pathology seen in Duchenne muscular dystrophy. Further supporting this link, the same microdystrophin treatment that improved muscle function in Golden Retriever Muscular Dystrophy dogs also mitigated the pathological lymphangiogenesis and reduced pro-inflammatory cytokine expression, such as interleukin-6. Other forms of canine muscular dystrophy. While Duchenne muscular dystrophy is the primary focus, dogs can also suffer from other severe myopathies, such as congenital muscular dystrophy. A case study described a Staffordshire Terrier with this condition resulting from a mutation in the laminin alpha-2 gene. The laminin alpha-2 protein is a structural component of the basement membranes, linking the extracellular matrix to the dystrophin glycoprotein complex. The affected 2-year-old dog exhibited a chronic history of a stiff, short-strided gait and difficulty opening its jaw completely. High creatine kinase activity was noted, and muscle biopsies confirmed a dystrophic phenotype with marked variability in muscle fiber size and prominent endomysial fibrosis. Immunofluorescent staining definitively confirmed an absence of the laminin alpha-2 protein in the muscle cryosections, while dystrophin staining remained normal, ruling out a dystrophinopathy. Genetic sequencing identified a large deletion encompassing exon 5 of the laminin alpha-2 gene, establishing a diagnosis of laminin alpha-2 deficient congenital muscular dystrophy. This form of muscular dystrophy, which is typically autosomal recessive, causes severe, progressive clinical signs and carries a poor long-term prognosis, as specific treatments are currently unavailable. Closing thoughts on care and future directions. The profound insights derived from research using canine models, from the Golden Retriever Muscular Dystrophy dog to the modern Delta E50 Muscular Dystrophy model, underscore the complexity of Duchenne muscular dystrophy and the promise of targeted interventions. For clinicians, recognizing the early and persistent elevation of muscle enzymes like creatine kinase is paramount, even if clinical signs are subtle. Furthermore, cases exhibiting myopathy warrant careful monitoring for heart issues, utilizing tools like echocardiography and 24-hour electrocardiogram assessment. Special precautions are necessary for dystrophin-deficient dogs undergoing anesthesia, as volatile inhalant agents can exacerbate membrane instability, potentially leading to hyperkalemic cardiac arrest. Total intravenous anesthesia is generally recommended for these patients. For research, the development of highly sensitive and objective biomarkers, such as the eccentric contraction decrement protocol, provides a statistically powerful method to measure therapeutic success, demanding only a small cohort of animals for preclinical testing. The demonstrated success of gene editing in systemically restoring dystrophin protein, even in cardiac tissue, combined with the possibility of metabolic support via nicotinamide supplementation, offers immense hope for refining combination therapies in the fight against muscular dystrophy. Thank you for listening. The titles for the referenced papers are in the video description. From Vet Med Digest, where we keep minds inspired, hearts light, and tails wagging.